Hi, this is Ming Chu, the injury guru. I'm also the author of the book, The Permanent Pain Cure. I'm a physical therapist located here in New York City. I specialize in soft tissue and myofascial therapies, and I am the inventor of the Ming Method. Today, I want to talk about what happened way back in 2004, when I was working with Jason Kidd. If you don't know who Jason Kidd is, I'm sure you do. He was a very famous basketball player. He was probably the best point guard in that era. He played for the New Jersey Nets at the time. And he was injured for 4 or 5 months, and playoffs were coming. And they basically panicked because he had a left knee injury that put him on the injured list. So fortunately, I got a phone call from his agent, Jeff Schwartz, and Jeff asked me if I knew who Jason Kidd was, and I said, of course. I actually knew exactly who he was. And I get a phone call from Mr. Kidd himself, and lo and behold, 2 days later, he ends up in my office. And what was pretty shocking was Jason came into my office, and here he was in live, and I see him on TV all the time. Here he is just sitting next to me talking. It was kind of exciting, nerve-wracking, and just a little intimidating, and I really wanted to help him. But the funny thing was, I was a New York Knicks fan, and he was a New Jersey Nets fan, and the Knicks and the Nets that year were rivals. Anyway, so Jason comes in, he literally limps into my office, and he said his pain in his knee was quite severe, and he had been hurting for over 4 or 5 months, and a lot of the therapies that the medical staff did wasn't really helping any, so he was seeking me for a different approach. Upon investigating, I actually looked at his hip, and he told me that the doctors diagnosed him with a left knee bone bruise, but his hip to me was the problem. His left psoas, his left glute medius, his left piriformis, and also his right piriformis as well was a problem, as well as his neck was off. I did a bunch of series of tests, range of motion tests, to see exactly what was wrong and what was missing. And I simply just treated those areas. And I actually told Jason that I didn't think he had a bone bruise in his knee. He goes, well, that's what my doctor said. I said, well, I think, let me prove it to you. What if I treated other parts of your body, not touch your knee, and see what happens at the end of the treatment? So that's exactly what we did. So I worked on those areas I mentioned. Namely, I did a lot of work on his left glute medius and piriformis, and also his left psoas and his left rectus femoris. And also I did some work on his right side because I saw he had quite a bit of restriction on his right side as well. After the treatment ended, it was about a 45-minute session. He got off the table, and I said, Jason, walk around. Mind you, I never touched his knee at all. And by his account, he said that his knee felt at least 70% better, which I was, wow. I said, wow, it exceeded my expectations. I thought it was going to feel somewhat better, but 70% better is a huge, huge improvement for a 45-minute session for a man who's been suffering for 5 months. So he was very happy with that. A few days later, he came back, and we actually gave him a second treatment. And I actually touched his knee this time because I wanted to see if his patella was okay, which it was. And there was no real problems in his knee, like I said. And I think looking back, now that I realized what was going on, it was simply an issue of his psoas muscle, his rectus femoris was very, very tight, filled with adhesions and scar tissue, as well as his IT band was being pulled up from his glutes. And simply by releasing that, his knee became normalized. And it was actually a quick fix. It was an easy fix. And I was very happy about it because I didn't think it was going to happen that fast. And the therapies that most professional teams employ are basically ice, electrical stimulation, pool exercises. I've done a number of videos talking about how I think ice is overused, and I think it's actually quite harmful. If you look at some of my old videos, I give a full explanation for that. And the electrical stimulation, I'm not even sure if it even works. So in favor of doing traditional physical therapy, I purely use what is now called the Ming Method, which is a series of very intensive myofascial release techniques that I did on Jason. And within 2 sessions, he was basically cured. So the next time you have an injury, Even if you think it's a pure orthopedic injury, say a knee or a shoulder or even a slip disc in your back, it's well worth it to investigate to see if it is truly a myofascial issue. It is my opinion that if you trace back any injury, 98% of the time you will have some fascial origins somewhere, someplace. And all you have to do is correct those distortions in the myofascial regions, create some blood flow, and lo and behold, it just gets cured. I mean, that's just how it works. So the next time you get an injury, before you, fall into despair, if you're not getting the results that you're looking for, try the Ming Method. Buy my book, The Permanent Pain Cure. It actually has a lot of great ideas as to how you can help yourself. It's a how-to book, a self-care book that will teach you about myofascial release, fascial stretching, and also spinal decompression stretches, which will really help virtually any injury. So give it a try, let me know, pick up the book, and if you like the content of this video, please subscribe. This is Ming Chu, the Injury Guru. You can contact me at mingmethod.com, and stay healthy, keep your fascia nice and supple, and you will thank yourself with a pain-free body. Good luck.